Hello, everyone, and welcome. We're just going to give everyone a few minutes to join us. Thank you for being here. While we're waiting, it would be great if you can share with me if you're taking the test for the first time or if you need to retake it. Are you taking the RN or the LPN exam? Please write in the chat so I get to know you a little bit. And if you can also share with me if you're joining from, where are you joining from? I'm based in New York, and I wanted to know which state do you live? So we get to know each other, and hopefully I can answer some questions before we start the actual presentation. We're waiting for some people to join us. So I know it's lunchtime and it's very hard to take the time off either from work or your personal life. So we're going to wait just a few minutes. So in the meantime, as I said before, if you can share with me if you're taking these tests, if you're taking the NCLEX for the first time, or if you are repeat test takers. Now, some of you may have also graduated, just finished graduation. I know there's a spring graduation in many schools, so maybe you just finished graduating from nursing school and you're ready to take the NCLEX, or maybe you finished a long time ago. But in any case, please share with me so I get to know you a little bit before we start our presentation. Okay. Okay, so we have a first person who just shared. Great. Brianna, I hope I'm pronouncing your name correctly. Brianna is from New Jersey. Okay, so a little bit. Okay. So we're here recording our Facebook Live webinar. We're going to be talking about the 5 mistakes that students commonly make when it comes to taking the NCLEX. And before we start, I wanted to welcome all of you, of course, and get to know you a little bit in terms of your situation. Right now, are you taking the test for the first time or a repeat test taker? Where are you based? I'm based in New York City. So the first person who shared is Brianna from New Jersey. And if you don't mind, Brianna, letting me know if, are you taking the test for the first time or you need to retake it? Okay. Now there's another person, Arvin there. I am from, I think CA, I think it's California, right? Right now I'm studying yourself studying. Okay, very good. So now that it's already 12:05, I think it's a good time to start. So we don't run out, we're not rushing, right? And hopefully after the live webinar, we can answer all the questions you may have. So I think we're gonna start the presentation now. Great. Okay, so now I don't know how to minimize this. Okay. Very good. So this is really exciting. Very, very exciting. So first things first. First of all, my name is Angelica Feuer. I'm the president of Feuer Nursing Review. And today's presentation, we're going to be talking about how to pass the NCLEX. Specifically, how to stop repeating the same mistakes over and over. Because over the years, I have spoken to thousands of students preparing for the test, and they usually struggle with the same issues, most of them. So today, we're going to be talking about the 5 most common mistakes students make. I'm not saying those are the only mistakes, but these are the most common that I hear. A little bit about myself. I've been teaching this review course for the past 25 years. The company, For Nursing Review, has been in existence for over 50 years. That's a very long time. And it was started by my mother-in-law, Dr. Helen Feuer. And then when she retired, I took over, and I have tried to do my best to update everything and to give the best possible NCLEX review course. So that's a little bit about myself, because the important thing is to talk about the topic of today's webinar, right? So when it comes to taking the NCLEX, whether you're taking the NCLEX for the first time or if you need to retake it, the number one mistake that I often hear from students is when students, out of desperation, okay, they study from multiple sources. So what is it that I usually hear from them? They say, you know, I bought this course and this video, and I've been doing YouTube tutorials, and they're studying from so many sources that what's happening to them is they are getting overwhelmed with sensory overload. It's too much information to process, right? So they, as I said before, they have resource overload, multiple books, apps, YouTube channels, some are free, some are paid. And what does that do to your brain is creates confusion. Instead of getting more information, it is very important that the information you're learning and studying is clear in your mind. When you study from too many sources, you create a sense of confusion, you get overwhelmed, and you're all over the place. Now, that is the problem when you study from so many different sources. Now, the solution, what is the solution? The solution is that you select very carefully 2, maximum 3 high quality comprehensive materials, okay? And the key word here that I want to emphasize is the word quality. Quality is always much more important than quantity, okay? And that's actually what you see in your personal life, right? Quality versus quantity. So when it comes to NCLEX review preparation, you need to really pay attention to, are you studying from 1 or 2 sources with high quality material, right? Because as we know, there is a lot of information out there about NCLEX preparation, especially on YouTube. And many of these sources are for free, but it's also not to say not all of them, but some of them are the quality is not so good. So kind of cheap, yes, it's for free, but you don't get necessarily high quality content. Now, so again, the solution to that will be you need to structure your study plan and you need to focus on high quality material, okay? If you feel, if you share with me this, if you agree with this mistake number 1, please share in the comment and tell me if this sounds familiar. Now, when it comes to Another mistake that I often hear from students is they often tell me, in this, the school told me, or my professor told me, you need to do thousands and thousands of questions, and I still don't know why I can't pass this test. And that's something I often hear when they said, do you think I'm doing enough questions? I'm doing 200 per day. And again, to repeat what I just said with mistake one, the quality of the questions is very, very important. We know that the test, the NCLEX is a knowledge application test, right? We already know that. But we also need to pay attention that the questions they ask you are at the level of application and analysis. So if you just answer questions, randomly questions, you're not really making very much progress, and you're mistakenly thinking, oh, if I answer 1,000 questions or 3,000 questions, I'm going to be well prepared for the test. Well, you do need to answer questions, okay? I'm not saying you don't need to, but it is important that you answer, number one, high quality analysis and application questions. And number two, when you answer these questions, do you know what is the concept being tested? Because that is important. And why is that important? Because the same question can be answered differently. And if you don't know, if you don't really know what is the concept they're being testing you on, you're going to answer the question incorrectly. So you do need to know, you do need to answer hundreds of questions, right? They have to be high quality questions, and you need to know what is the concept being tested, okay? That brings me to the next part of the solution. You need to use each question as a learning opportunity, especially if the question you are answering, you answer incorrectly, you need to know, you need to understand the rationales to understand both the correct and incorrect choices, because you can learn a lot about your weaknesses. What are your weaknesses based on the selection of questions? How do you select? Which answer did you select? And if that answer was incorrect, why did you answer that question incorrectly? Which is the concept that you need to review? We know concepts like safety and infection control are often asked on the test. They also ask you about prioritization, delegation of patient care, and so forth. So you need to study these rationales to understand both the correct and incorrect answers, okay? Mistake number three. This is a classic mistake that I often hear when I talk to students. They usually say, they say to me, you know, I took the test, I failed, and I can't wait to get this over. So I already applied. They do have to wait 45 days, right? They have to, after the 45 days, they think, okay, I already waited 45 days, so I want to schedule my test and I want to pass this test because I want to put it behind me. And I understand the rush. I understand that you want to pass the test because for obvious reasons, you need to get this license, right? To provide for your family, to start making money and so forth. However, this is, if you fail the test and you need to retake it, is so important that you take your time to analyze what went wrong, right? Because what happens is that if you study, for instance, the same way the second time, and you rush into taking the test, you probably will fail a second time. So you really need to take a deep breath, heal from the experience. Failing a test, whether it's the NCLEX or any test, is devastating. It really hurts your self-esteem to the core. You start doubting yourself and you said, am I stupid? What's wrong with me? Because I talk to students all the time. They doubt their intelligence. Should I quit? Should I quit? Should I look for another profession? So all these is emotionally devastated to fail the NCLEX. So that's why it's so important that you take your time and heal from this experience, from this traumatic experience. Once the healing takes place, and that changes, that's different. For everybody's different. It will take me maybe 1 week or 1 month to heal. Somebody else will take a longer time. That's okay. Each one of us is a different individual, a different human being, and you have different ways to adapt to change or adapt to failure, right? You're failing the test, by the way. You're not a failure, you just failed the test. So you need time to heal from that, failing that test. Then you need to reflect, well, what went wrong? Is it that there were content areas that I did not review, I did not understand? Is it that the test anxiety took over me? What is it that went wrong? And then once you get to that point that you really analyze what went wrong, then you can say, well, it's time to plan again. Time to design a different study plan that is more focused on what I need, right? So you need to reflect. That's why we put here. You need to reflect, you need to recalibrate, and then you need to say, now it's time to come up with a new study plan, something different, something that it will address my learning needs and my learning style, right? Instead of just rushing into something that definitely you need time to plan strategically. So if you're going to be successful, you need to take your time and really think, what did I do wrong? And what am I going to do differently next time? Now, mistake number 4, repeating the same study methods, expecting different results. I believe it was Einstein that quote, you probably heard that Einstein's quote that it says, the definition of insanity. The definition of insanity is like when you go crazy, right? Is you keep doing the same things over and over, expecting different results. And that's never gonna work, because whatever you did in the past, if it didn't work, you need to come up with, what are you gonna do differently next time, right? And this idea that if you keep doing it over and over, you're gonna get a different result is not, first of all, it's not true. And then it keeps you stuck. It keeps you stuck in the same place, right? So you need to change your strategy. You need to change to active learning. You need to create study maps or join a structured program. You need to do something differently, because you need to change your study method to get different results, right? Also, please comment with me if you feel, if this resonates with you, if this is something that you agree or disagree with me. And it's okay if you want to disagree with me, but I want to hear from you if this is something that sounds familiar, right? And if you have taken the test before, what do you think you will do differently next time? Okay. Now, mistake number 5. Mistake number 5, is when the student has unrealistic expectations. They don't have an effective study plan. They don't really understand clinical judgment. And what they do is they study from not only multiple sources, but a little bit, and then they don't have a plan to study with a certain schedule, that a place, a time, and a structure. And what creates is they study all over the place and they don't really focus on the content that needs to be addressed, right? So there are two critical issues here. Number one is the lacking of an effective and realistic, and the word here is effective and realistic study plan. You cannot achieve success on the NCLEX if you do not have an effective and realistic study plan. It's the same as if I were to go on a vacation to Florida and I take a plane to California. I'm not going to go to Florida. I'm not going to get to Florida, right? So you need to set realistic expectations and create a study plan that addresses your learning needs, your learning style, and also takes into consideration your personal life. Some of you, when I talk to students, they tell me, okay, I'm working full time, I'm a single mother, I have other responsibilities. And then I said, well, can you realistically set up a study plan that you can say every day you're going to study for, let's say, 2 to 4 hours with exactly knowing, prioritizing the concepts you need to review? And they said no, because the reality is at the end of my busy day, I'm exhausted. I come home, I collapse. So then I said, well, you need to make changes to your personal life. So you're going to be able, maybe you can work the three or 4 days in a row, maybe one day less. And then you create a study plan that will allow you to review the content, the test taking strategies, and do all the practice questions, because it's not realistic that you're going to continue your personal life like that and still have the energy and time to study, right? So a balanced study plan, by the way, is a plan that includes a content review. And when it comes to content, I'm not talking about reading thousands and thousands of pages of med-surg or BPs and psych, because the reality is the NCLEX is not going to ask you, first of all, you're not going to pass the NCLEX with just memorizing facts. What they're going to ask you is certain concepts you need to know, and how to apply those concepts to nursing practice. That is what you need to learn. So first is, what is the content you need to know? Okay, so the study plan needs to be very clearly described on what is exactly the content. What are the NCLEX style practice questions you need to practice? And also the study plan needs to allow for some rest and relaxation, maybe 1 day a week, something like that. So there is a well balance between study and your personal life, and you may have to work. So between study, personal life, and work, you need to find that balance. Okay. So that's I think that is the most important, actually the number one mistake, even though it's mistake number 5 here. I think this mistake includes both critical points, one being the effective study plan, and the other is study to have a clear understanding of how clinical judgment will be asked on the test. Okay, because some of you, when I give the classes, students often said, I don't really understand how to apply the clinical judgment to the NCLEX questions. That is also very important, to have a clear understanding. How are you going to be recognizing cues, analyzing cues, prioritizing the hypothesis? Once you have a clear understanding of that and a realistic study plan, you'll be going to be able to pass the test. So that is very important. So I think we cover almost all of it, and let's see the rest. Okay, so to recap a little bit about the study plan. What do you think the study plan should include? Well, an NCLEX, a complete study plan, should include a focused content review. And the word here, when I want to emphasize the word focus, meaning very specific content, not just all content, but the concepts that are going to be tested on the NCLEX. NCLEX style practice questions, test-taking strategies, application of clinical judgment skills to clinical scenarios. You need to practice with a lot of unfolding case studies, bow tie and trend questions, and prioritization of patient care. Now, what has happened in the past when I talk to students, they say, well, my school, with my school, I get, they already signed with specific NCLEX review course, but that didn't work for me. And I often hear that, and that's why the students feels sometimes lost and confused. What am I going to do? I tried, and I don't give you the names. You know the names, the famous names of the big players, the big review, the review courses. But unfortunately, not these type of review courses don't work for everyone. And because of that, some students need extra preparation, supplement, content review. And what I have found is that review courses that only emphasize questions, like for instance, UWorld. UWorld is a great review course. It's great with questions and answers. Now, however, even though it's a great review course, and many students have said to me, I don't understand. Why is it that I pay UWorld a lot of money and I did thousands of questions, I still failed the NCLEX? And then I usually say to the student, is because you don't have a good foundation of content. And without that good foundation of content, you cannot expect you're going to pass the test. You need to have everything that I told you here in the plan to be successful on the NCLEX. Everything means a good and in-depth content review. In-depth content review, the questions, the plan, the instructors. They need to be instructors who are qualified to teach the review course, right? And that's a very important consideration when selecting a review course. Who is teaching this review course? Who are the instructors? Do they have clinical and teaching experience? Okay, are they up to date with the NCLEX curriculum? So those are very important considerations, right? Now, so recap, as I said before, studying from multiple sources without a clear direction is never going to help you pass the test. You're going to be overwhelmed with resource overload or sensory overload, and you're going to get confused, overwhelmed, increase your stress anxiety without a clear direction of what do I need to do to get where I want to go, right? So multiple sources only creates confusion. Number two, focusing on answering questions without understanding what are the concepts being tested, right? You can't just answer questions without really knowing what is the concept being tested. Because then what happens usually is students try and start memorizing the answers. And when you memorize, then they can give you a situation that is similar, but it's really asking you something different, and you answer the question based on your memorization. And that should never happen. You should always answer the question, whether it's a matrix, highlight, whatever question it is, based on your content information, right? Based on what is your understanding of the concept being tested, not on your memory. rushing into retaking the test without really reflecting, without really taking the time to say, well, what went wrong the last time? Maybe it wasn't the right time to take the test. I talked to students who said, they have said to me, I took your review course, it was great, but I didn't pass the test. And then I asked, what do you think went wrong? And the student, they're very honest. I said, I think going through a very bitter divorce, or maybe there was a death in the family, something happened that prevented them to be, you have to be in a good emotional place to pass this test. So sometimes life gets on the way and you are, rushing into taking the test and don't realize that your emotional state of being is not the best to study, right? So you need to never rush into taking big decisions. So take your time, healing emotionally and reflecting, and then create a study plan. Number 4 says repeating the same study methods and expecting different results. And that's something that I already said it before. We're humans, right? Human beings, sometimes we do those things. We think, okay, next time I'll just try harder and I'll go over these over and over, and I'll read my flashcards again and again and again. Well, it didn't work. It didn't work before. So try something else, try something different. Now, something else that I forgot to say that is very important. For any of you who already have taken the test, please, 2 things. Don't put yourself down thinking that you're a failure. You failed the test, you are not a failure, number 1. Number 2, what happened in the past is gone. You cannot recreate, you can't bring the past back, but you can say, we only have the present. We don't even know what's going to happen in the future, but right now we only have today. And today you're going to do the best you can. And the worst thing you can do is you can reflect on what went wrong. You can reflect and say, okay, reflecting, that's a positive attitude, connotation. But don't dwell and say, oh my God, I failed. What if I fail again? Oh my God, what am I going to do? Don't do that. You need to bring positive energy to your life. Lacking an effective and realistic study plan, I can't emphasize enough, you must have a well put together, realistic, structured study plan that is simple, clear, and concise. And that's what sometimes students complain about these big companies, and they said, it's so hard to understand. It's boring, hard to understand. And I agree with that. I agree. So when it comes to review courses, be very, very careful in selecting something that you know has a good reputation and the information is taught by experienced instructors and is simple, clear, and concise. That's what you need to be successful on the test. Now, some of you may be looking for a review course in the next couple of weeks or months, right? So I decided to share with you some of our programs. Our next class, we have an excellent class coming up, May 17th to the 20th from 9 to 5 p.m. Eastern Standard Time via Zoom. And as you can read here, as you can see on the screen, it consists of a 4-day live online review via Zoom. Then the 4 days, how are the 4 days broken down? We have 2 days of medical surgical nursing. We go over the most frequently asked concepts of medical surgical nursing. 2 days of that, an in-depth content review. Then we have a day of pharmacology. Then we have a day of test-taking strategies. And we give you 3 printed books, so you don't have to take any notes. Everything is there for you. You can highlight, you can take notes, and you don't have to, just have to concentrate on paying attention to what the instructor is telling you. And you can also ask questions, and the answers will be on the spot. It includes, now this next class coming up includes, after the 4 days, is going to include 2 months access to the 4-day lecture and a question bank. We also give you a certificate of completion. Now, in addition to the question bank, you're going to have access to recorded videos, pre-recorded videos for maternity, newborn, pediatrics, and psychiatric nursing. Okay. Now, I also included here other dates in case May 17th to 20th is not a good date for you. We have classes coming up from June to December. Pretty much every month or every other month, we have classes. And that's for the RN as well as for the LPN. Now you can enroll for these classes for only $329. The offer ends on April 28th, so you can take advantage of these now. Sorry. And we have payment plans in case you can. I think we use PayPal, so you can pay these in 4 installments, so it's not that much. And that's something to think about, right? Now, I also included here our website, as well phone number, email address, and our social media, okay? So at this point, I think I'm gonna stop because I really want to hear any questions or comments or suggestions you may have. So I'm going to stop here, and please, please, please share with me any questions, suggestions, or comments you have. So I'm gonna stop sharing here, and I wanna hear. I just don't want to do all the talking. I want to hear from you because I want to help you. I want to help you in any way possible. You may have a question that I can answer right away. And if I don't know the answer, I'll do my best to find the answer and get back to you. Okay. So, Brianna, if you're still there, please share with me, since you're a retaker, you're retaking the test. Can you share with me what study method do you use, and maybe the how do you study? That would be great. Okay, so I want to thank everyone for coming. I know it's difficult to take a break at lunchtime. So thank you so much for attending this live webinar, and I will be seeing you soon. Take care.